PowerPoint, and we don't use it so much in our classroom, and we're just switching things up, and we're going to stand over here, so I hope that's okay. And we're doing our presentation together because that's how we work, yes. And I'm Tim, and I've been the chair of the Health Education Department at City College of San Francisco. Most recently taught a chronic conditions management course for the CHWs.
And I'm Avila, I'm the program director of the Community Health Worker program, and now we also have 2 additional programs. And I actually also teach the core courses and the intro classes when that's what I do. So,
well, and we have so much to say. We're so proud of our program, and you know, you will have to cut us off. So, you know, we'll signal loudly. You know, our department does sort of half career and technical education training and half sort of academic courses. We have a transfer pathway. We have a new Metro Academies transfer model based actually on research out of Kingsborough College on the success of their learning communities that we built on in our program. But we're part of 8 CTE certificates that train frontline public health and social service workers. So in addition to the ones that we'll talk about today, we train and certify drug and alcohol counselors, healthcare interpreters, HIV, STI prevention educators, community mental health workers, and trauma prevention and recovery workers, folks that are working with communities in the aftermath of violence. The 3 certificates that we'll talk about today all share the same core courses, and those are the community health worker, which was started in 1994, our youth worker, and our post-prison health worker certificates.
And those folks started in 2009, 2010, post-prison and
yes.
So these are 2 relatively new. So we're not going to talk about the history because it really has been done of community health workers. One thing that we do want to say though is that, and it's been kind of a nice tie with the City College of San Francisco, is that I also am a committee member of a Visión y Compromiso, which is a statewide network of 4,000 promotoras in California. And so what we do in the Northern California chapter is we put together workshops and trainings for promotoras, primarily monolingual Spanish speakers. And it's been really nice because as a community college, we're able to provide them space, resources, instructors, and skills. And when we have meetings and symposiums over there, we will always ask them, well, what is it that you need? And they have always responded, more training. And it's been wonderful because this group primarily, you know, well, a large portion are undocumented. And so because of that, it's very difficult for them to sometimes get into the educational academia. And so we're able to kind of supplement that and provide them with skills. And City College has been wonderful in supporting that, you know, the promotoras of California as well.
Sometimes there can be tension, competition between a college-based training program and community-based programs. And we've just really worked to try to diffuse that, to collaborate together, and to say, it doesn't matter to us where a community health worker is trained, as long as they get good quality training.
So the 3 programs that Tim spoke about, we have the community health worker, which is a 17-unit program, the post-prison health worker, which is a 20-unit program, and the youth worker, which are 22-unit programs. So all of these programs can basically be completed in 2 to 3 or 4 semesters. And there are brochures in your packet that outline the exact courses that you have to take as well as possible electives. So we won't go into the detail. But we do want to let you know that depending on the student's status as far as whether they're working full-time or not, they can complete this in 2 to 3 semesters. And many of our students are getting multiple certificates. So one of the things that we've been able to do is an elective course that is required for the post-prison health certificate can be a required course for the youth worker. So this way they can, you know, kind of take cross classes and be able to get multiple certificates at the end of their graduation. And like Tim said, all 3 courses share the core foundational courses, which are 10 units, 5 in the fall and 5 in the spring. Right? And you want to talk a little bit about how these certificates work?
Well, just, you know, I mean, all of our certificates are developed in partnership, but both the youth worker and the post-prison health worker, the idea for that didn't originate with us, but it originated from the community. For example, we worked with a community-based organization, Legal Services for Prisoners with Children, and the local Department of Public Health that has the first primary care clinic in the country that focuses exclusively on providing services to formerly incarcerated patients. And together, we developed this new certificate based on competencies that the community told us were essential for frontline providers working either in jails or prisons or with folks who are formerly incarcerated or their family members. So that's our model.
And so the first step to any of the programs that students may want to get is our application process. And in order to apply for the program, they need to fulfill either one of two prerequisites. One, taking a one-unit introduction to community health work, one-unit class, which is basically 6 classes or something like that. Anyway, it's a one-unit class, or they have to have worked in the community for at least 1 year, in which case then we ask a supervisor to provide a waiver letter. We accept applications once a year. Unfortunately, because of funding, we really have only space for about 40 students a year. And so when we do our applications in May, then we just finished doing actually on Friday our selection process, and then we put other students on a wait list because it is an impacted program. We have 2 to 3 times as many applications as we have slots. So it's, you know, it really has grown, and this is with almost 0 outreach. So we know that there is a need, and one of the things that we'll talk about in, later on when we talk about our future roads is one of the things we're looking at is potentially we have, doing some more distance learning type of classes so we can do outreach to other students who can't quite make it. Let's see what else I need to tell you. So, just as like a lot of the other programs, our pedagogy is looking at adult education, integrating, popular education, because we know that students learn by doing, and that is very important. And most important is their life experience, because not only are they there to learn from us, but we're there to learn from them, and they learn from each other. And we make sure to validate the fact that they have that life experience is very important in the work that they do, and that is how they're going to be able to really outreach and reach the people that we really want to get.
And I'd just say that that one-unit prerequisite course is important because it's where we give sort of informed consent to students. We let them know about the certificate program they might jump into and the field or profession that they may be entering. And it's a chance for us. We don't ask them to take college math or English placement courses. Some students come to us with an 8th grade education. We didn't do that because we didn't think that those tests were really highly accurate in terms of assessing the literacy levels that is required to be an effective CHW. But we do in that course also screen, right? We're assessing students' reading levels, their oral communication skills, and their writing skills, and then trying to gently steer students to any more sort of, and I hate the word remedial, but foundational literacy courses that they might need before they come and apply to us again, because we don't want to set up students for failure. We want them to have a success. We also try to increasingly teach not just the core competencies that all the other programs have talked about, how to provide client-centered counseling, how to do motivational interviewing, but also to continue to boost over a year study their reading, their writing, their quantitative reasoning, and their oral communication skills. And that means that we as content faculty have had to learn, we're constantly learning how to teach better. We're here because we know public health. We don't know how to teach writing, so we've had to collaborate with our English and ESL faculty to help us learn skills on how to scaffold basic foundational competencies in reading, doing textual analysis, and writing. Because the employers will say, no, they don't need to write a 20-page research paper for us, but they better be able to document clearly and accurately the services that they provide to clients.
So some of the main features of our curriculum include things like it's reality-based, which means that both our faculty and, how we teach are people from the community. So we do have a lot of speakers that come in. Most of our faculty are from like health departments as well, or from clinic agencies, or or any agency that works with communities. Our teaching methods, in everything that we teach, we always bring in the students' life experience because it's important to validate that and to let them know that experience will help them not only succeed, but also that they have gained some knowledge during this time. So even if they were incarcerated for 10 years, during that time they probably learned skills. Or they were taking care of a sick mother. During that time they learned skills. They probably learned how to case manage. They probably learned how to document. They probably learned how to advocate. So all of that is important as well. We also do a performance-based examination, which I think John had talked about a little bit when we did the community health works. And what that means is at the very end, before they can get their certificate, one of the criteria is that they pass this performance-based exam, which is basically about a 20-minute or half an hour intake interview where they incorporate all competencies. And it's our employer partners that are actually just doing the exam with them, because they are the ones that are going to be able to tell us, are they ready, or are they our internship in the spring? And so we really work with them, providing them interviewing skills, doing workshops, doing library research so that they can be as prepared as possible. And while we don't have an employment placement component, we do everything we can to make sure that when they go out there, they're as marketable as possible. And that all of their skills transfer to any other industry if they ever decide to.
And good luck to CUNY, and think of us
Yes,
as lifelong
thank you.
partners. We're on this journey together, and we'll continue to learn from each other.
Great.